is Dr. Barbara Bartlik. Dr. Bartlik is an integrative psychiatrist. She is a leader in integrative mental health and sexology. There she is.
Hi.
And Dr. Walke, can I just ask you to turn your camera off?
Yeah, I'm working on that right now. Sorry, I don't know why
That's okay. You can stay here, and the
well, I'm
three
going to try.
ladies
No,
look
I don't need to be the
wonderful.
center of attention here. I thought I was like, why am I not letting me get out here? I hit stop sharing. There we go. I
Just
found it. I
shut your
found it.
camera,
Yeah,
maybe.
there we
Yeah.
go.
Okay. Okay, Dr. Bartlik, I am getting your slides.
Thank you, Sherry.
No problem at all. And you're good to go.
Great. Okay. Well, thank you so much for inviting me. I'm delighted to be sharing with this wonderful group. I love the mission of getting out the word about male breast cancer. It's so important that you're doing this. So, first, a little about myself. I went to Albert Einstein College of Medicine in the Bronx. Then I went to NYU for residency at NYU Bellevue in psychiatry, became a psychiatrist. Then I studied sex therapy and got board certified in sexology and treated a lot of sex therapy patients. And then after that, in around the year 2000, I became interested in integrative medicine, natural healing, vitamins, minerals, and herbs. And that led to my becoming board certified in the new specialty of integrative medicine in 2018. And at the same year, I came out with a book in the Dr. Andrew Weil Integrative Medicine Library called Integrative Sexual Health. And that's a little of my background. And now I'm in private practice in Manhattan, and I practice a natural, holistic approach using natural therapies as well as standard therapies and medication with my patients. Next slide, Sherry.
There you go.
Thank you. So, men with breast cancer face certain psychological issues that are unique to them. Many men do not share their emotions as easily as women do. They keep to themselves. They've been taught since they were little boys to keep a stiff upper lip, and that has been studied. Girls are allowed to cry and express themselves more than boys are. So men, they get less support when they have an emotional issue, and they ask for it less than women do. So they tend to close up. They keep it a secret till they absolutely have to share. And I don't mean all men, but many men do, and that can be a problem. And I've learned about many men who really did not share that they had breast cancer until the very last minute when they really had to, with employers and friends and so forth. So it becomes like a secret. And part of that has to do with the masculinity issue. Okay, it's a challenge when a man has a disease that is perceived as a women's disease. The breast cancer, it's predominantly women, so men are in a distinct minority. And it is embarrassing, and there's some shame associated with it. Also, being that they are living with a life-threatening illness, there are concerns about the future. How will their life change? Should they go for that extra certification and go to a higher level, or should they just relax and enjoy their life as much as they can? So there are future concerns that men worry about when they have cancer. Financial concerns. I've heard devastating stories about men who had to take time off work to go through treatment for breast cancer, and bad things happened. They lost their job, they lost their health insurance, their marriage fell apart. I mean, there are a lot of losses that occur, that can occur. So it's very scary. There are legal issues. You want to make your will and things like that that you don't normally think about. And then peer support. Okay, if a woman gets breast cancer, there are so many peer support outlets. There are specialty groups. I mean, you can go to a group for women with breast cancer having trouble with tamoxifen. They're very, you can find your group. Sometimes men are referred to groups for women and they just don't go. They don't feel comfortable. The things the women are talking about, they just can't relate to. They need their own groups. And fortunately, through Sherry's organization, they now have them through Facebook. And that's very good, very important. Men with cancer, breast cancer, can suffer from depression, anxiety, irritability, even post-traumatic stress disorder, which is connected with going to war. It's that devastating. In addition, the hormonal treatment, tamoxifen, which is a long-term thing, that can cause depression as well as sexual dysfunction. And then men react to that. If they have sexual dysfunction, they might get more depressed. So we have, a lot of issues that men with breast cancer confront. May I have the next slide, Sherry? Okay. Now, strangely enough, doctors often have a blind spot for male breast cancer. A lot of times the patient comes in with a lump and the doctor doesn't refer them for further treatment. It's shocking how often that happens. There seems to be some denial on the part of the medical profession not to recognize the symptoms of breast cancer right away. And men don't recognize the symptoms also early. Men take longer to get to treatment, so they present for treatment at a more advanced stage of the disease. And they have lower survival rates as a result than women do. With women, women are taught to do breast self-exams all the time and always reminded of taking care of that. Men, it doesn't register as a part of their body that they need to look at. A man might feel out of place at the Centers for Treatment for Breast Cancer. They're typically so female, all women's magazines, women's artwork. The staff is shocked when they get a man in there. A lot of times they don't handle it well. The mammography technician may be insecure about the type of mammogram she's doing. She may have to get a supervisor. And all of this makes a man who's going through a workup for breast cancer feel very uncomfortable. And it can add to the trauma of the diagnosis when they feel like, people are fumbling around, not knowing how to handle them. Also, aftercare can be less for men. Women are provided with all sorts of options about, garments to wear and how to get a wig and all of that. And I've heard stories where men haven't been given the simplest thing, like a compression garment to wear across the chest that will reduce the pain. Men are not, they don't think men need that. Well, they do, and it does help. They may also not be advised adequately of the side effects of the chemotherapy and tamoxifen. And if they're not advised about what could happen, they won't know that they can take action to counteract that. And that brings up the sexual problems. If a man has sexual dysfunction from tamoxifen, he might discontinue it if he doesn't know all of the wonderful things that he can do to counteract that. Next slide, please. So this is how to recognize a depression. When it creeps up on you, it could happen at any time. It's kind of hard when you're dealing with cancer to separate out what's cancer related and what's depression, because in both you have lack of appetite, low energy, and sleep disturbance. So, what is from the cancer? What is a real depression? One really key symptom is something we call anhedonia. It means the loss of interest or pleasure in your usual activities. So something you used to love to do, it no longer gives you great pleasure, and it might give you no pleasure. You feel nothing when you do it. If you have a depression that goes on for weeks, seemingly without end, you should see a doctor about that. Maybe something can be done to relieve that depression. There may be excessive guilt or blame, hopelessness, irritability, low self-esteem, a lot of body image problems. Okay, with women, because women wear bras, they can hide a lot of any irregularities. Because men don't wear bras, there's an unevenness, and a lot of men have body image issues and the scar, they don't want to take their shirt off in public, or where they might have taken their shirt off to exercise or run or go to the pool or the beach. There's problems with that. Also, there can be a lack of focus, tearfulness, trouble sleeping, and suicidal thoughts. Next slide, Sherry. Okay, so the cancer and depression, this has been studied a lot. And what we do know is that cancer patients are about 5 times more likely than the general population to suffer from depression. So only about 1 in 4 patients suffer from depression when they have cancer. So, and it's not just the individual, the whole family is affected. The whole family is afraid for the person who has cancer. It affects everybody. The whole family could get upset and depressed about this. There is experience loss, like I told you about before, that man who just basically lost everything due to his cancer diagnosis, and anticipated loss, like, what about that trip I was going to take? Will I ever do that? That wonderful goal that I had, an anticipated loss. People can get depressed about that. There are metabolic changes. We now know that people with depression, they often have inflammation, and cancer also is an inflammatory condition. There can be anemia with cancer, electrolyte imbalances. All of these chemical changes make a person more prone to get depressed. In addition, sleep disturbances are an issue, and that could be due to the cancer itself, the discomfort, the stress, the trauma, keeping you up at night, or it could be due to the medical treatment that you receive for the cancer. And then suicide. It's much greater in cancer patients. They estimate 26 to 85% greater, depending on the study, a greater risk of suicide. Now, the ones who are at most risk happen to be men, people who are older, single people without a significant other, and those with the worst cancer prognosis. Next slide, please. So, post-traumatic stress. Who gets it? When you're going through a traumatic situation, if it's handled very well and you feel supported through it, you're less likely to develop PTSD. If it's not handled well, and you have a lot of negative feelings about the experience afterwards, a lot of regrets, then you're more likely to get PTSD. So look at the column on the left. Those are people who get PTSD, people who have unmet informational needs. Well, doesn't that sound like male breast cancer? From everything we've heard from speakers today, we don't know a lot about it. Okay, it's not really fleshed out the way that women's breast cancer is. There are unmet informational needs, lack of social support, high stress situations. Cancer is a life-threatening situation. And to meet the diagnostic criteria for post-traumatic stress, you have to experience some kind of life-threatening situation to yourself or others. An avoidant coping style, people who do not confront problems head on, who avoid, those people are more likely to suffer later on from PTSD. When people have a recurrent cancer, that can bring on PTSD. Also, if the cancer is difficult, advanced, if there's a difficult surgery involved, a lot of pain, that can also trigger post-traumatic stress. And also their personal psychiatric history. If a person has a history of trauma, anxiety, depression, they're more likely to develop PTSD. common triggers for having a post-traumatic stress symptom is chemotherapy. Going back for chemotherapy, if maybe you need another round, that'll could trigger a post-traumatic stress reaction. Painful treatments. I believe it was Charlotte who mentioned scanxiety, okay? When they have to go back for their MRI, their CAT scan or other scan, x-rays, that can trigger a whole scene of scanxiety. Going back into the medical setting, person can get a feeling of dread just walking into a medical setting after they've been through cancer treatment. Some people will say, you know, if I have to undergo chemotherapy again, I just won't do it. It was so awful. Other people have a easier time of it. Now, the symptoms of PTSD are intrusive thoughts, upsetting memories, and these are obsessive. You can't get rid of them. It's hard to do anything else. Flashbacks where you actually feel like you're undergoing the trauma again of what you went through with the diagnosis or the surgery. Nightmares about the condition that keep you up at night. Irritability and increased reactivity, where you might have a startle reaction. It means your nervous system is on edge and the slightest thing can set you off. Clouded thinking, insomnia, guilt, and what they call a loss of interest in life, or a foreshortened sense of the future. Like you can't plan, you don't want to plan, you don't see a future. Next slide. Okay, tamoxifen. So they say this is a long-term thing. Average treatment 4 years, but it may go on for 10 years. 20% of men discontinue treatment early due to the side effects, but we learned from Dr. Pablo Leon this morning that it could be even higher, 40%. It causes depression as a side effect, irritability, mood swings, fatigue, hot flashes. In fact, 13% in one study discontinued due to the hot flashes. Memory and cognitive problems, 9% discontinue for that reason. Sexual problems, 22% discontinue. And weight gain, 22% discontinue. Next slide. Less common side effects of tamoxifen are blood clots. 9% discontinue due to this. And sometimes the doctors tell the patients to discontinue because this can cause life-threatening situations like heart attack, stroke, pulmonary embolism. There's also bone loss due to the low estrogen, bone pain, cataracts, gynecomastia, which is enlarged breasts, and insomnia and leg cramps and other muscle cramps. Next slide. Now, if you go to a psychiatrist for a depression, the psychiatrist is likely to put you on an antidepressant medication, but you need to make sure that it's not one of these that interfere with your tamoxifen, because there's an enzyme in the liver that activates the tamoxifen into the active form. And if you're on certain antidepressants, namely Prozac, Paxil, and Wellbutrin, that will inhibit that enzyme and your tamoxifen will be weaker. So those are the strong inhibitors. The moderate inhibitors are Cymbalta and Zoloft, so you should stay away from those as well. And some psychiatrists may not be aware of this. You might be put on those medications, but then your oncologist would pick that up, no doubt. The safer antidepressants are the following 6: Effexor, Pristiq, Luvox, Remeron, Celexa, and Lexapro. Other psychiatric medicines that are not antidepressants that are safe are gabapentin, which is called Neurontin, olanzapine, which is Zyprexa, and Risperdal. You should avoid tricyclic antidepressants, which aren't given very much anymore anyway, and Abilify, which is now given to augment antidepressants. Next slide. Now, there are some nutritional supplements that you should avoid when you're on tamoxifen as well. DIM, diindolylmethane, which is used to clear hormones from the body. That interacts with tamoxifen. You cannot take that. Melatonin for sleep, you can't take that. St. John's wort, which is used as an antidepressant, you can't take that. Turmeric, which is used for everything, and vitamin E. You cannot have that. They interfere with the activity of tamoxifen. Also, you can't take anything that increases estrogen, such as black cohosh, DHEA, licorice, red clover, and soy supplements. Next slide. So, what to do about sexual problems in men on tamoxifen? There are just so many options out there, medical and holistic, okay? The most popular are the Viagra-like medications. They work so well. The vacuum pump with or without rings, penile rings, that you could, I mean, you need the ring for the pump. You can also use the ring alone. Penile injection therapy, where you actually inject the side of the penis with a very fine needle. Sounds horrific, but it works extremely well for severe cases. Pelvic floor exercises like Kegels can strengthen the erections. There are urethral creams that you could get compounded by a pharmacy that you put into the urethra with a tiny plunger, and that helps erections. Topical penile creams, some are now available over the counter and FDA approved, and others are prepared by compounding pharmacies, and they have skin softeners in them to penetrate the penis skin. And then there are the sex positive foods. Okay, if you want to have a sex positive diet, you want to have plenty of protein, plenty of healthy fats, as in fish and olive oil, and low carb, low bread and things like that, sugar. You want to keep that low and have nutrient dense foods like vitamins, vegetables and fruits that are organic and high in antioxidants and phytonutrients. Also, there are many oral nutritional supplements that can help with sexual problems in men. Next slide. Now, there are natural therapies that you can take. These are vitamins, minerals, amino acids, and they have been studied and published in our most prestigious journal in psychiatry. The American Journal of Psychiatry published a meta-analysis that showed that these supplements are effective in treating depression, and they are methylfolate, omega-3 fatty acids, SAMe, and vitamin D. The next level of effectiveness, there were just positive isolated studies, were amino acid combinations, things like, tyrosine, tryptophan, things that improve blood flow, such as arginine. These amino acid combinations, they make neurotransmitters. And that the big surprise was that creatine, which people use for bodybuilding to increase their muscle mass, that was antidepressant. So some people are now taking creatine for that, but you can get kind of a anger situation sometimes if you use too much of it. So you have to be careful. And folinic acid is another type of folate, which is effective. Next slide. This is a big surprise. A lot of people don't know that the medicines they take, the common medicines that we all take, that most Americans take, can deplete their vitamins and minerals. So I say, if you're on a medicine, check if it depletes vitamins and minerals. You might take a proactive step and take those vitamins and minerals that are being depleted. Now, acid blockers, PPIs, very common, but look at what they deplete. And that's why they say don't be on them for more than a few weeks in the physician's desk reference. Look at all of that. If you deplete all of those nutrients, that's going to make a person unwell. Also, Glucophage, also called metformin, it depletes B12 and folate. Who knew? Antihistamines deplete vitamin C. Blood pressure medicines, they vary a great deal, and some deplete these nutrients, others don't. So you have to check with each medication. And the non-steroidal anti-inflammatories like Motrin and naproxen deplete vitamin C, iron, folic acid, and potassium. So if you're going to be on those medicines, you should take some of those vitamins. And the statins deplete CoQ10, and that's what causes the muscle aches with statins. Next slide. So if you have nutrient deficiencies due to medication, that can cause mental and sexual health dysfunction. You need these vitamins and minerals to make your neurotransmitters, to clear out your hormones and to make hormones, and to aid blood flow. They open the blood vessels, and without them, for instance, magnesium and arginine, your blood vessels will clamp down, and that's very unhealthy. Okay, so you especially need to make sure that you get adequate amino acids in protein, and that could be a protein supplement or food. B vitamins could be food or supplements. Meat, liver especially has B vitamins. Calcium, iron, magnesium, omega-3, potassium, sodium, zinc, and vitamin C and D. Okay, if you go on a multi plus an omega and maybe some amino acids, you've got it all covered. Next slide. So there are a lot of therapies that can help men with breast cancer. Cognitive behavioral therapy is very systematic and helps you identify the thoughts, feelings, and behaviors that can be destructive to you and counteract them with positive thoughts. Any kind of counseling, psychotherapy is helpful. Couples therapy is helpful because cancer does put a strain on the marriage, and problems that maybe were covered up before can come out then. Sex therapy is extremely helpful. And then there's eye movement desensitization and reprocessing therapy. That's where you follow the therapist's finger with your eyes like this. And it while you're thinking about a traumatic event, and it helps you process that memory. And it was developed based on REM sleep. When people move their eyes from side to side, that time in sleep is supposed to help process memories. So it's very effective, and it's used a lot in treating people with PTSD. And then there's the emotional freedom technique, also called tapping therapy, where you tap the acupuncture points. And the therapist teaches you to do that. And you can do it with the therapist or eventually do it by yourself. And while you're thinking about your issue, and it offers relief. And then the best are the support groups for men with breast cancer that the Male Breast Cancer Global Alliance offers. It's a private member-hosted community on Facebook, very essential. Next slide. So, self-care options for better mental health and sexual health. Okay, there's nutrition, botanicals, vitamins, minerals. In fact, some oncologists recommend for men taking tamoxifen to preserve the bone, they recommend taking vitamin D, calcium, and magnesium. Check with your physician. And vagal stimulation is very important. The vagus nerve is the one that goes from the brainstem through the neck into the torso down to the genitals, and it is responsible for calmness. And in our day-to-day world where we're on the computer all the time, actually that counteracts the parasympathetic rest and digest nervous system that we want to make stronger, and people go into sympathetic dominant. So we want to counteract that with things that will stimulate the vagus nerve. That is the rest and digest portion of the nervous system. with breathing exercises, like Charlotte mentioned this morning, the importance of breathing in the slow exhalation. There are a lot of different exercises you can do. Cranial electrical stimulation has been shown to stimulate the vagus. Meditation, stress reduction, and a couple that aren't up here, red light therapy and pulsed electromagnetic field therapy. These are things that I do in my practice, and they are very helpful for calming you down. Exercise, as Leslie said, is the best medicine. And it's the best antidepressant. They've done head-to-head studies where some people are given a prescribed program of exercise and others are given an antidepressant medication. And you know what? They perform equally. So, if you're depressed, the best thing you can do is get out and exercise. The way Leslie said, it should be fun. It should be something you want to do every day. Maybe ride your bicycle, play tennis, whatever it is that you like to do. Engage in a sport. It improves your circulation, your vitality, and your sexual function. Now, acupuncture has been studied. Acupressure has been studied in cancer patients, and it has been shown to relieve cancer-related fatigue. And there are apps that show you how to do it. Good hydration is essential. A lot of people are not hydrated well enough, and it really messes up their brain. It can make you depressed. It can make you confused. Memory is not good. And they're also finding it can be responsible for joint problems. A lot of pain comes from poor hydration. And then there is spending time in nature as much as possible, getting sunlight, or do as the Japanese do, they go in the woods, they call it forest bathing. Get adequate sleep, 7.5 hours is ideal. Listen to music and engage in pleasurable activities. Sherry, next slide. Now, vitamin D is good for fighting depression and helping sexual dysfunction. Vitamin D is made in the skin by exposing it to sunlight. Now, where we live in New York City in the winter months, we cannot make vitamin D at all. So we rely on our stores and supplementation. Or people can use a light box that will help make vitamin D. A light box, a therapeutic device that you put on your table. In the morning, you turn it on for about 20 minutes and you get something like the sun's rays. Very helpful. And many of my patients depend on taking a winter vacation to a sunny place. That really, fights the depression. Next slide. So one reason that vitamin D is so important is that it helps you make dopamine. That's the motivational neurotransmitter. And it helps motivate you to do things you want to do and have some energy and vim and vigor. And you can't make it unless you have vitamin D, because the enzyme that makes dopamine requires vitamin D. The genitals are rich in vitamin D. And studies have shown that, men who lack vitamin D have sexual problems. When they supplement the vitamin D, they get better, their testosterone goes up. It's important for brain function, and it aids in the absorption of the most important mineral of all, magnesium. Next slide. Okay, so the water, okay, check out your water, okay? There's a lot of problems with the water supply. The Environmental Protection Agency has guidelines, but they're 20 years old, and they don't have guidelines for the new contaminants that are in the water. In New York City, they put chlorine and fluoride in our water. You can smell it. It's very bad for your thyroid. The water in certain communities has carcinogens, hormone disrupting chemicals, radioactive compounds, arsenic. I had a patient in my practice. We discovered she had elevated arsenic. It was from her water. And believe it or not, the water can even have PFAS, what's in Teflon, the forever chemical. It gets in your body and it never comes out. Some people have even had to go through repeated blood donations to get the Teflon out of their body. Next slide. So, what can you do to reduce your chemical burden, to get these toxins out? Well, first of all, make sure that your channels of elimination are open. That means address constipation. If you're not having a bowel movement every day, there's something wrong. You need to address it with hydration, fiber that could be in the form of vegetables or in a fiber supplement, and magnesium and other supplements, as well as more physical activity. Now, I see this in psychiatric patients all the time. Half of them are constipated and they have no idea. And it's really, I think that the toxins accumulate and it affects their brain. Also, you can eliminate toxins through the skin, through sweat, exercise, and sauna. And you can also go on fasts and cleanses where you deprive your body of the way you normally eat and take certain supplements and protein shakes that will help your liver process the toxins. Next slide. Okay, magnesium. Half of all Americans are deficient in magnesium. I give it to all my patients in psychiatry. They all need it. Magnesium deficiency can cause constipation, insomnia, anxiety, depression, obesity, hypertension, arrhythmias, inflammation, diabetes, and sexual dysfunction, and hundreds of more things. Magnesium helps you make nitric oxide, which opens your blood vessels, and acetylcholine, which is important for preventing dementia. Your brain needs it. Acetylcholine is in all of your neurons. It relaxes blood vessels. Magnesium helps erections, reduces blood pressure. It makes the neurotransmitters, dopamine and serotonin. Every step of neurotransmission requires magnesium. If you're constipated, take magnesium citrate until your bowels are right. If you're not constipated, don't take magnesium citrate because it could give you diarrhea. Take magnesium glycinate or a chelated magnesium. If it's hard on your stomach, some people are very sensitive to it, you can get magnesium through a bath in Epsom salts or topical creams. Next slide. Follow an anti-inflammatory diet, which is similar to the Mediterranean diet, which is low sugar. I recommend gluten-free, dairy-free. I think those are inflammatory foods, but not everybody will comply with that. Your diet should be soy-free, only free-range grass-fed meat and poultry. The fish should be small, no larger than your dinner plate, wild caught. Organic fruits and vegetables, go by the Dirty Dozen or the Clean 15, and plenty of extra virgin olive oil, only in glass bottles. Next slide. What to avoid? Bovine growth hormone, antibiotics in meat, poultry, and fish, animals fed with GMO corn and soy. I realize this is controversial. Not everybody thinks GMO is bad, but I do. GMO fruits and vegetables, you can see them. They're unusually large and perfect, but they don't taste as good. Like strawberries, they're gigantic. Farmed fish can be very dirty with runoff from the land. Large fish like tuna and swordfish contain a lot of mercury. So use them sparingly, if at all. If you eat canned foods or use plastic wrap, that can get in your food, and that has endocrine disruptors in it, BPA and BPS. Trans fats and seed oils that are heated to high temperature are very inflammatory, and cancer is an inflammatory disease. You want to stay away from that, and all processed foods. Make all your own food from home. Avoid alcohol, which increases the risk of cancer, and additives, preservatives, and artificial sweeteners. Next slide. So there's one way to measure inflammation that's a simple test called the highly sensitive C-reactive protein. Um, the liver makes CRP in response to inflammation. The CRP binds to dead and dying cells and removes them from the body. So when you're feeling good and you're healthy, your CRP is low, and it goes up when you have some kind of health challenge like cancer, immune dysfunction, chronic medical illness. And I've seen that in individual patients. When they're sick, their CRP goes way up to like 10, and when they're well, it goes down to, between 1 and 0. So, you can kind of monitor how inflamed you are by asking your doctor to get that test. Next slide. Okay, here are just some resources for you. The Environmental Working Group, which is up there. You can ask about, how healthy a certain product is, a cleaning product, a food, or you can find a lot of help there about how to stay clean and green. At the bottom, we have something about tap water, and then there were a lot of sites for cancer and integrative medicine. Next slide. And this is my last slide. Okay. I want to thank you all for having me speak to you today. It's been my pleasure. And that is my book, Integrative Sexual Health, there. And all my information about where to reach me is there on this slide. So thank you so much.
Thank you, Dr. Bartlik. It was a pleasure having you here with us today. I do have a couple questions for you that came in. So if you're ready, let's see what we have here. How can a man support his mental health if he feels pressure? Goes back to what you said in the beginning, to stay strong and not show vulnerability to family and friends.
That is precisely the crux of the problem. And feel they must stay strong for their family and friends, and not show emotion, not show weakness, not break down and cry. That's how they are. But they need some nurturing themselves, and they're not going to get it if they always put on that strong demeanor. So, we want to allow men to be human too.
You have to be vulnerable.
Yeah. Yeah.
How can men cope with anxiety during checkups, scans, and the fear of recurrence, especially when those fears linger long term?
Yes. So we don't want you to shy away from treatment because of anxiety, which a lot of people do, you know. Um, there are lots of ways to deal with anxiety, okay? One is talking it out with others, with peers, with friends, with medical professionals. So many men don't go to the doctor, or their wives have to drag them to the doctor, and that's how they often get diagnosed. Their wives have to send them or make them go. Anxiety can be reduced with all of the things that I mentioned on that slide about lifestyle, the breathing, the treatments like cranial electrical stimulation. You can take medication to reduce anxiety. There are, the benzodiazepines I did not mention. Those are anti-anxiety pills. They are completely fine with tamoxifen, no contraindication at all. You can take those. The safe selective serotonin reuptake inhibitors like Effexor and Lexapro, you can take those. They help with anxiety. If you feel like taking medication, you could see an integrative practitioner like me, and I might give you, for anxiety, magnesium, 5-HTP, and zinc, omega-3, B vitamins. It could be something chemical underneath it all that's making this man anxious. And if you can reduce his baseline level of anxiety, then maybe he could tolerate the scanxiety and wait for his checkups.
Yeah, because that is real.
Yeah.
What are the signs that a survivor should seek professional mental health care, and what types of therapy or counseling are most effective for cancer-related trauma?
Well, it would be nice if the cancer treatment facilities offered therapy through their facility with a therapist who is familiar with the issues. That would be nice, and many of them do that, but not all of them do that.
Mm.
So it would be nice to get a therapist who is familiar with the issues, right? But really, the key when you're finding a therapist is to get somebody who's compatible with you. And that could be, that could be not even a professional, it could be, it doesn't have to be a psychiatrist. It could be just some counselor, a coach, but your personalities have to jive.
Yeah.
Right? And so if you find yourself going into therapy with someone and it doesn't feel right, change. Don't stick with them. Go somewhere else.
Yeah, because then it becomes stressful.
Yes, that's right. Yeah.
Okay, what do I have here? One more for you. What strategies help men rebuild confidence and sense of identity after physical changes from treatment, including surgery and hormonal effects?
Okay, so building confidence. You know, I think living a healthy lifestyle, all of those things that I mentioned in the slides, they are very important. Okay. Some people, after they have cancer, are in better shape than they ever were in their life. You can see before
True.
pictures of them and they've lost weight and they're toned and they're fit and they're, as you mentioned, running races and climbing mountains and so forth, but they work at it. And
Mhm.
in some ways having cancer can be a blessing because it's like a wake-up call. You have to take care of your body and your mind. So, you know, got to make some changes. You got to stop eating the junk food and
Mhm.
take some nutrients, exercise.
It's true. I know when I worked with I used to have a fitness coach that I worked with and a nutritionist. And the nutritionist told me the first thing she said is when you go to the food store, shop the perimeter. You don't have to go in those aisles unless you need cleaning products. And I looked at her like, but what if I need? No, you get fresh vegetables. You don't get the canned vegetables. And it's a mindset that I guess stuck with me. Because actually, I don't go in those middle aisles. I shop the perimeter.
Right. But, you know, in the old days, a can of Campbell's soup was just fine.
Oh, I
In
used
the,
to eat SpaghettiOs, so I know.
I would have ramen noodles when I was in medical school. I would never do that now because that's full of chemicals, and we know
Yeah,
better now.
yeah. Well, thank you so much for everything today. We appreciate you being here. It was wonderful. And this concludes our session for today. See if I
Sherry,
can get back
pleasure.
to my slideshow. And we do have the second part coming up tomorrow. We begin at 10 a.m. And I think we go until about 3:45 or 4 o'clock. But I wanted to thank our sponsors again, Lilly, Pfizer, who you heard from today, Daiichi Sankyo, and Novartis for making this possible. Please join us tomorrow for the second part. And we do have upcoming events with Dr. Barbara Bartlik. You might want to tune in. I've been sharing that on social media. That is on November 18th, when she's going to be discussing coping with cancer-related distress and anxiety. So thank you very much for today, and we hope to see you tomorrow.